barely a month after the Uganda government announced that it will deploy medical professionals to the Democratic Republic of Congo in efforts to tackle the Ebola outbreak from the eastern region. Reports say at least 30 people have died since the start of May in one camp for displaced civilians in northeastern Congo, a death rate that the camp officials said were unprecedented and, because of the symptoms, could indicate Ebola is spreading fast there. It was not possible to confirm the causes of the death because patients or their relatives in Kigonze camp in Bunia, the epicenter of the Ebola outbreak in Democratic Republic of Congo, had until Thursday, June 18th, refused testing the living or dead, a camp spokesperson and aid organization Caritas said. However, all the symptoms, including headaches, fever and vomiting, which are associated with Ebola, a camp spokesperson, a bereaved father, 3 aid sources and a civil society leader told Reuters. Camp President Junjor Indroti said 10 people were buried this week alone. The deaths in the camp, which has more than 15,000 residents, raise fear that Ebola may be circulating undetected among eastern Congo's over 5 million displaced people, with resistance to testing compounding the challenge posed by severely limited sanitation measures. Grodia said health workers had now taken samples from 5 victims and were awaiting the results. Cholera also has Ebola-like symptoms and spreads quickly in poor communities, though it tends not to transmit person to person. 4 aid workers said the spike in deaths highlighted how communities were now more exposed to disease such as Ebola, as donors, including key contributor the US under President Donald Trump, have cut funding for water, hygiene and sanitation, which is essential in fighting a disease that spreads through bodily fluids such as human waste. Data compiled by the UN showed that funding for toilets and hand-washing stations in Congo more than halved between 2024 and 2025 to at least $38 million, and this year's $80 million appeal is only 21% funded. In the camp, large families share the same plastic tent, spaced less a meter apart, and children water its dirt alleyways barefoot. There are toilets marked USAID, Washington's international aid agencies dismantled by Trump, and an aid source said the agency helped fund their construction. However, Grodia and the aid source said there were not enough toilets and they often overflowed. Congo has hundreds of camps for civilians fleeing war, some home to 100,000 people. Ebola deaths have already been recorded in another camp in the same province of Ituri, which has over 90% of nearly 900 confirmed cases.